Hi, you guys. Happy Thanksgiving and welcome back for our daily practice questions. As always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. All right. And so you know that our Black Friday sales have been live. I see that y'all have been taking advantage of those. I hope that y'all are finding all of the resources helpful, and I look forward to hearing your success stories. Again, happy Thanksgiving to you guys, and thank you for all that you do. All right, let's get into our questions for today. Question number one. A 30-year-old woman presents with a 10-day history of nasal congestion, facial pressure, headache, and a yellow green nasal discharge. She also reports worsening symptoms after an initial improvement. There is a tenderness over the maxillary sinuses on palpation. What is the most appropriate treatment for her condition? Is it A, amoxicillin and clavulanate? Is it B, saline nasal spray and intranasal corticosteroids? C, referral for a CT scan of the sinuses? Or D, supportive treatment with analgesics and decongestants? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. Here, the stem of the question states, what is the most appropriate treatment for her condition? So y'all know I always tell y'all, if they're asking for a treatment, you need to run it back and see if they have provided you with a diagnosis. And if they have not provided you with a diagnosis, you need to run it back a step further and look at those assessment findings so you're able to determine a diagnosis, right? So here, how this patient is presenting with the nasal congestion, the facial pressure, the green nasal discharge, sinus pressure, tenderness on palpation, we're thinking sinusitis, right? So you want to think of the treatment, the initial treatment for this. This patient has worsening symptoms. They have yellow green nasal discharge. So we would treat with A, which is your augmentin, that amoxicillin and clavulanate or clavulanic acid, okay? So A is your best answer. Question number two. A 28-year-old male presents with a 10-day history of nasal congestion, facial pressure, and a thick yellow nasal discharge. He also complains of a headache that has been worsening over the past few days, especially in the mornings. On physical examination, you find tenderness over the maxillary and frontal sinuses with an associated fever. What is the most likely diagnosis? Is it A, allergic rhinitis, B, acute bacterial sinusitis, C, chronic sinusitis, or D, pneumonia? Take a moment and tell me what you got. All right, so stem of the question here states, what is the most likely diagnosis? So when looking for a diagnosis, we need to run it back and look at those assessment findings. So this 28-year-old male came in with a 10-day history of nasal congestion, facial pressure, and thick yellow nasal discharge. He also has a headache. It's been getting worse on exam. Maxillary and frontal sinuses are tender. He also has an associated fever. So this would be B, acute bacterial sinusitis, right? Because this is an acute issue. And then lastly, question number three. A 45-year-old male presents with symptoms of acute sinusitis, including nasal congestion, nasal discharge, and facial pain for the past 5 days. He has a history of seasonal allergies, but no significant past medical history. He denies fever or any other systemic symptoms. What is the most appropriate management for this patient? Is it A, to start antibiotics for the suspected bacterial sinusitis? B, recommend a nasal decongestant and saline irrigation? C, prescribe a 5-day course of oral corticosteroids? Or D, refer to ENT? Take a moment and tell me what you got in the comments. All right, so stem of the question here states, what is the most appropriate management for this patient? So again, we're looking for treatment. So what are we treating? Again, this is acute sinusitis, but in this scenario, this patient, they have symptoms of acute sinusitis. They have some nasal congestion, nasal discharge with the sinus pain in the face, has a history of seasonal allergies, doesn't have a fever or any other symptoms. So the best thing is B, you want to just recommend like a nasal decongestant, saline irrigation. I'm combining saline and saline irrigation of that the nostrils, right? So that we can clear those areas and see if that gives them any relief. If they have more of a fever, or if it explained like the type of charge that they may be seeing, um, then you would want to bump up to those antibiotics. But in this case, we can do B, recommend a nasal decongestant and saline irrigation. Okay. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, as always, feel free to reach out to us at the Nursing Studio by giving us a call at 803 400 6864, or shoot us a text message to this number. You can also shoot us an email to the nursing studio, the number one at gmail.com. Now, typically, I will tell you that everything is linked in the bio of this channel, but our Black Friday sales are going on. So the link in the description takes you to all of the discounted Black Friday sales. So if you're going to go that way. Okay. But if you do look at the links in the bio of this channel, I already have the discounts in place. So either route that you take, you should find it. But everything is all under the Black Friday link in the description to make it easier for you guys. Okay. All right, you guys, I know what you do. Y'all make sure y'all meet me back here. Happy studying. Happy Thanksgiving. Bye, y'all.